Stroke is an emergency and time is brain. Patient coming in with signs and symptoms of acute stroke at the hospital should be seen immediately by the brain attack team. And this is made up of the neurologist, a stroke nurse, the ER medicine physician, facilitating with the radiology department in order to ensure that this patient really has a stroke or to rule out a bleed because of the proper treatment that is available. And there are now drugs that can remove the blood clots from the brain, okay, and provide better outcome that if this compared to if this were not given. So important is the patient should be in the hospital. It is important that patient recognize that he or she is having a stroke. And the acronym of FAST, Be Fast, and Be Faster is being promoted everywhere. What does it mean? Be Fast means B stands for balance, sudden loss of balance. E, sudden eye problem, blindness or visual cuts. F, look at the face. Is there facial asymmetry? A, stretch the arm, see if one arm is drifting, or do an arm roll if one arm is not moving. Speech, check if you're slurring of speech. And T is the most important. And T is time to go to the hospital. Not just any hospital, but an acute stroke-ready hospital that can provide them with the service. Now, fortunately, beyond 4.5 hours, the medical city can provide an additional service. And that is by the provision of mechanical thrombectomy, a procedure done by our interventionalist who can put a catheter into the blood vessel and remove the clot. And that can be done among eligible patients even beyond 4.5 hours and even up to a certain time. So it is important that you should go to a hospital that can provide all these services. Now the acronym has changed. It should be now Be Faster. E stands for emergency room. Okay, you have to go to an emergency room that can provide a hospital. And the R would be recovery. This is very important because after a stroke, we can provide services like rehabilitation, education in order to prevent stroke, and we want to maximize the improvement of our patients. Stroke is preventable. Let's not forget about that because we don't want to have stroke. The best way to prevent stroke is not to have one. And so we have to know the modifiable risk factors that we can do. We cannot do anything more about the age, about our sex, but then the treatment for hypertension, for diabetes, atrial fibrillation, cholesterol problem, dyslipidemia, even patients with snoring or even stress. Okay, we should all cut down, and good proper lifestyle, a lifestyle modification is very important in order for us to prevent another stroke or even to prevent the first stroke. So remember, be faster. Okay, tell that to everyone because they have to be in the hospital within a certain period in order for us to provide what can be done if they come early to the hospital. At the medical city, we make sure that our patients, when they get discharged, they are fully aware of their type of stroke and the risk factors that they can modify. And here, we provide individualized stroke education for our patients that are about to be discharged from the hospital. Again, if you have a stroke, be sure you remember the word Be Faster and immediately go to a stroke-ready hospital, not just any hospital, a stroke-ready hospital like the medical city.